Hello everyone, my name is Shirley O'Shea. I'm a Health Promotion Officer with the HSC, Health and Wellbeing, and welcome to this pre-course webinar, Healthy Weight Management, as part of Project Weight Loss Training. This presentation is going to provide you with some background information in understanding overweight and obesity in Ireland, and it provides the context with which we've developed Project Weight Loss. It's really important to be able to understand obesity if we're going to be able to support people as they try and lose weight and maintain weight loss. A lot of information contained in this presentation is expanded upon in more detail in your Project Weight Loss manual. So I'd advise you to go back over that, and also you can look up a lot of the information that I'm going to present in more detail online. But please do write down any questions you may have as we go along, and I certainly hope to address them when we get to do the live webinar on Zoom next time we meet. Okay, so let's get started. What I hope to cover over the next 30 to 40 minutes for today's session is a little bit around the health policy context in Ireland and the background by which we developed Project Weight Loss. We're going to look at some of the prevalence in terms of overweight and obesity statistics in Ireland, and also physical activity participation currently in Ireland. What are the health impacts of obesity, and what are some of the underlying causes of obesity also. So that's really all I'm going to cover for today's session. When we meet on the live Zoom call, we hope to go into more detail along with my colleague Claire DC in health promotion. We're going to look at weight stigma and bias, and what are some of the issues in relation to that. How do we look at attitudes and beliefs around obesity, and how does that impact upon how we provide programs for people in the community. What are some of the weight management approaches that are currently out there now? What are some of the best practices we can use, including strategies and techniques we know are effective in weight management, and also the important area of understanding behaviour change, and what are some of those approaches. One of the ones we're going to look at in more detail is motivational interviewing. Some of you may be familiar with some behaviour change techniques and strategies. Motivational interviewing is an approach I feel that's really conducive to Project Weight Loss, because it's very much about working with people from where they're at. It's about you as the leader, the instructor, and the skills you have in which to encourage and support people in their change, in the choices that they make every day, and how we can use those skills in order to support people. So that's really it in a nutshell in terms of the training. So we'll make a start on some of that content now. So Welcome and Project Weight Loss, as part of that, was funded under Sláintecare, the new health strategy for Ireland. The framework for health and wellbeing is Healthy Ireland, which some of you may have come across already. It's a whole of government approach to health and wellbeing in Ireland, which means that a number of different government departments are involved in the delivery, led out by the Department of Health. And its role in promoting health of the population in Ireland is that we need organisations and agencies and government departments to collaborate and work together, because that is going to be the best way in which we can promote health, and also look at the needs of the whole population. It's not just the remit of the health services, but also its education, its environment, its transport, its sport, its community. So working collaboratively together to deliver on this framework will be the best buy for the health across the population. There's a plan to promote physical activity, increasing physical activity levels across population, and using the physical activity plan as an example of how Healthy Ireland will work through policy. So Get Ireland Active is the National Physical Activity Plan for Ireland. Some of you may be aware of it and its content. It aims to increase physical activity by 1% per annum across the lifetime of Healthy Ireland, which will bring us to 2025. Doesn't seem like a huge percent in terms of an increase, but we are starting from a very low base in terms of activity levels. Also, that translates to a significant proportion of the population becoming more active. We know we have a lot to do in terms of increasing physical activity, but also decreasing sedentary behaviour as well. It's divided into these 8 action areas, so it covers a lot of actions. Sorry, I will just switch off the sound there on that. So yeah, Project Weight Loss would come under the action area of sport and physical activity in the community, but obviously also health. So there's a lot of actions with various different stakeholders leading out on those actions. And again, you can download Get Ireland Active from the Get Ireland Active website or the Department of Health. A Healthy Way for Ireland is the Ireland's obesity policy and action plan. And this sets out a number of different actions to reduce the levels of overweight and obesity in Ireland, with an acknowledgement that there is a huge burden on the health services and the wider community. It covers a 10-year period, and its aim is to reverse the trend of overweight and obesity. The policy is presented in 2 parts. It's 10 steps forward looks at what are the solutions that requires action across a range of areas within the plan, a range of sectors being involved, and at lots of different levels. The plan has a focus on mobilising the health services in terms of action 6, with a focus on prevention, but also acknowledges the key role that physical activity plays in the prevention of overweight and obesity. So Healthy Ireland takes a survey annually, and this provides us with some data by which to see whether some of the actions that are being taken are actually effective. It covers a range of topics and health behaviours, including physical activity. What's interesting to note is that 60% of all adults now are either overweight or obese in Ireland. So we have more people, or we have less people, should I say, who are of a normal weight. We know that there's been some decrease in men since 2017. And those who are reported as having trying to lose weight is nearly half of those. So we know that most people do want to do something about their weight. The most common action cited for losing weight is to take more exercise. That was at 56%, and at 54% it was to eat fewer calories. So we know there's a huge need for programs like Project Weight Loss in the community. We know that the supports that are required for people, they need to be thought out, and they need to be based on evidence and best practice in terms of what actually works. What do people feel will help them? So the WHO, which I suppose we've heard an awful lot about recently, the World Health Organization, have identified as physical inactivity as a risk factor, the 4th leading risk factor for global mortality. So this provides us with a snapshot of what are the causes of global mortality in the world. And we see physical inactivity, 1.5 billion adults as being insufficiently active for health. We know that the different various colours there give you an indication of obviously those people who are in disadvantaged circumstances of a higher risk to their health as well. Again, you can look up the WHO's action plan on physical activity as well if you're interested in looking at more of that information. So Get Ireland Active provided us with the physical activity guidelines for Ireland, and we were one of the last European countries really that didn't have recommendations for physical activity for health. So as part of the launch of getirelandactive.ie, there was a key part of that was to encourage health professionals to know what the physical activity guidelines are for adults, but also in turn that adults would know what it is that they need to achieve for health. So 30 minutes a day of moderate to vigorous activity on most days of the week, or 150 minutes per week. With the key message being that physical activity is for everyone and that any level is better for your health than none. So really we're starting from people where people are very sedentary, what people need to do to start to become active, to reduce the sedentary activity and also to aim for that 30 minutes a day. For some people, that's a huge barrier in terms of a message because it's another thing to do on an already long to-do list. So we need to look at not only the 30 minutes of activity, structured activity maybe a day, but also where can we look for opportunities to be more active in our everyday life. So what are participation levels of physical activity like in Ireland currently? So this survey from Healthy Ireland in 2019 again measures various health behaviours, one of which was physical activity. So you can see the percentage of the population by age that are meeting the National Physical Activity Guidelines of 30 minutes a day. And that often decreases with age. So we know that the decrease as we get older correlates to our activity levels decreasing as well. So that when we're in the sort of 65 plus age group, when essentially we should have more time in our hands than any other time in our life, we are the least active. So what are the barriers for people as we look at these activity levels? Why are we struggling to meet those 30 minutes a day? This survey looked at all activity that people do as part of their work, as part of housework, gardening, as well as activity that they would spend time doing in their spare time, recreational type activity, as well as exercise and sport. They were also asked separately about vigorous activity. As you can imagine, that's a smaller proportion of the population, and they were also asked about time that they spend walking, with a difference between walking for commuting versus walking for recreation. So we have a lot to do in terms of trying to increase physical activity levels. Sport Ireland also in their surveys through the Ipsos MRBI survey provides us with a really good overview. And interestingly, when we look at the top 5 sporting activities of the population, exercise comes in as number 1, with 12.4% of the population choosing that as their activity of choice. So that takes into account those that attend gyms, personal training, classes in the community. So a huge scope there for us to meet the need for the population. Also note the differences in terms of gender between male and female participation, with the barriers in terms of gender, that the majority of childcare is left to mothers rather than fathers. So most mothers citing that childcare is one of the main reasons that they're insufficiently active. Interestingly enough, father fathers only cite that in less time. So physical activity is one of the only health behaviours where men do better than women. So I think it's important for us to acknowledge these gender differences and to understand the barriers and how gender impacts on our activity levels when we're dealing with a project like this. Okay, so moving on to the health impacts of obesity in the country. So the evidence shows that obesity contributes to over 200 conditions. We often think of the most obvious ones, like type 2 diabetes, cardiovascular disease, some cancers, arthritis, and mental ill health. We also know that those who live in disadvantaged circumstances are more at risk from some of these conditions as well. So we know that the underlying causes of health has a lot more to do with our working and living circumstances than it does with the health services that we can access. I think that in terms of how we address overweight and obesity, we are often looking at treating some of those diseases rather than the underlying causes. So we know a lot of this is preventable. And but yet if we look at something like type 2 diabetes, there's very few interventions that focus on weight loss or increasing activity or a physical activity intervention that might help and support people to become more active. So this is where Project Weight Loss can support people who are perhaps living with not just weight, but perhaps other chronic conditions as well. So when we're talking about overweight and obesity, we're defining it through body mass index. That provides us, BMI provides us with the population measure of overweight and obesity in Ireland. And it's the standard measure used to estimate whether or not people are underweight, normal weight, overweight, or obese. And a score of over 25 is considered overweight with scores of 30 or higher, obese. So in terms of Project Weight Loss, we had a criteria of people with a BMI of 25 or greater that could access Project Weight Loss. We thought it was really important that it met the target group that we are trying to reach. And it's really important for those people that are accessing Project Weight Loss that they know that they are going to be with others who are similar to them. One of the big barriers for people that we've been told is that opportunities in the community to be active, there's a huge stigma attached, there's huge reluctance and anxiety around perhaps just turning up at some classes in the community, and that what we need is specific targeted approaches that we know will support people to lose weight. However, this doesn't provide us with individual body composition when we talk about BMI. So in other words, we're not providing us with information around the proportion of lean muscle to body fat. Fiona Rush, the dietitian, is going to go into more detail around weight loss specifically and BMI and that side of things in her own session with you. So if you've got questions there, we can discuss that at that session. So this slide presents information around the misperception that is out there of what a healthy weight is. A number of years ago, Safe Food had a campaign called Stop the Spread. And it was all about knowing your numbers, if you like. It was about our perceptions of what a healthy weight was versus actually what people were reported as being. So we know that, for example, people perceived themselves as being what they thought was a healthy weight, but when in fact they were overweight. So some of the statistics presented here in percents, you can see the Growing Up in Ireland survey that was done also reported on 9-year-olds, and 54% of parents who had overweight children reported that they thought their children were about right weight for their height. So there are inaccurate perceptions of weight status than we know are actually there, and that's the difficulty when we are now normalizing overweight in Ireland, that when we eyeball people, we're making assumptions about you know, that's not me. So that's a huge barrier for people. If they don't associate themselves as being an unhealthy weight, then how can they reach out for support and for help? So it's important that we educate others on what BMI is, how it's classified, and what it really measures. More often than not, people rely on the scales and have a huge focus on weight loss. We know a lot of people have struggle with not only losing weight but sustaining that weight loss, and that can become part of a long-term you know, problem for people when they fail to maintain weight loss. So some key facts in terms of overweight and obesity in Ireland. We know this is an issue for all age groups, from children through to adults. 1 in 2 pregnant women will present at their booking visit for pregnancy for antenatal care as being overweight or obese. And we know even at older age, that 3 in 4 over 50s year-old age groups are overweight or obese also. So there's a huge impact that has on individuals, on families, on society in general. And part of the problem is that we need to recognise that obesity is part of a far greater complex problem, and it's not as simple as you know, moving more and eating less. So a specialist in public health, Harry Rutter, who talks about in this article how he's constantly asked this question about what is the single most important thing we can do to tackle obesity, as if there's some magic bullet that if we just did that, you know, we could manage this epidemic that is happening globally now. And what he said was that, you know, the single most important thing we can do is to understand that there's no one solution, that people's diets and activity levels exist in a complex set of interrelated factors, many of which that are outside of our individual control, and that our individual choices that we make every day are much a bigger part of the obesogenic environment that we find ourselves in. So what we need to do as individuals, as, you know, fitness professionals, as health professionals, is to try and understand that set of interrelated factors and how that operates within our everyday environment.
Are you up there?
Sorry, the joys of working from home. There's always someone looking for me. Okay. So getting back to this simplistic view of causes of obesity, many people with the viewpoint that if people just ate less, exercised more, then, you know, there would be no overweight and obesity. But we know, yeah, genetic factors are at play, but our obesogenic environment makes us more vulnerable to weight gain. You know, that we know that not only the biological, but social, environmental, and economic factors result in obesity. And we know that changes that have happened over the course of a generation have led us to, you know, across globally, an obese nation along with lots of other European countries. This foresight systems map, which is quite difficult to see there, but I just wanted to present it as an explanation of these structures that contribute to obesity. So this UK foresight systems map has a number of different themes and shows how one is interrelated to another, and that there are various different loops that impact in terms of a person's physical makeup, their eating behaviour and their physical activity patterns. So if we were to look at those themes in a little bit more detail, obviously people's everyday individual choices around food habits and individual physical activity operate within broader environments of our attitudes and our beliefs, our physiology, obviously, but also if we think about something like food consumption, how that is influenced by the amount of food cues we are being confronted with on a daily basis. That's really challenging when there are TV adverts, print media, billboards, cinema advertising, social media that are bombarding us with high sugar, convenience, high fat foods that we often consume as treats. That's going to be very difficult for people when they are being constantly nudged towards the unhealthy choice. Again, if we think about our physical activity environment, we've recently seen our communities having a lot of cars taken off the road, an increase in people walking and cycling, and an appreciation maybe of our green space as we see people outdoors more. We start to see the drivers of obesity in our communities and our towns and our cities, and how this is all related and part of the choices we make every day. One example of those interrelated factors here is this feedback loop. So if we take the demand for convenience, we are now operating with a generation of working families, both parents working, where the demand for convenience is met from the food industry with convenience foods, be it ready-made dinners, frozen food, food that's packaged ready to cook, like ready peeled and chopped vegetables. So foods that tell us that there's convenience, there's no cooking involved, it's easy, it's for people who are time poor. That then robs us of our skills of cooking, and that's not passed on to the next generation, and on it goes. So the European Association for the Study of Obesity provided a similar picture of these individual factors operating in broader environmental factors. So that things like, sleep and the impact that has on weight, that we often don't think of these things happening in isolation, but that we need to see those individual choices that we make every day operating in a lot of the other systems that we live and work in if we are to address obesity. I took this photograph from Professor Donal O'Shea's presentation he made a number of years ago. So Donal O'Shea is a very active commentator on obesity in the media. He's also the clinical lead for obesity in HSE. And he has a lot to say about what we are not doing to provide adequate treatment for obesity, but also in terms of how our environment is conducive to obesity as well. By providing the likes of this example, he talks about a toxic environment. If you take any regular garage that we have in all our communities where we live, 20, 30 years ago, the garage was where you went, you got petrol, you filled up the car, you paid for the petrol, you might have picked up a newspaper or some milk. But now you can get your dinner. You can get a special offer which gives you a fizzy drink or a packet of crisps. There's lots of takeaway hot ready-made food that you can buy that's usually high in fat and salt, low in nutrition. You can buy wine, you can play the lotto. While you're standing in the queue to pay for your petrol, you can pick up a chocolate bar that's probably double the size it was 10 years ago. And these are the everyday choices we're making with perhaps a little self-awareness that these are driving our everyday weight. So it's not something that happens in a short period of time, but over the course of someone's adult life, these are the cues we're being given that we can take without really being aware of. And if we look at how we plan our towns and cities where we live, not only is structured exercise important, but when our environment is designed and built to do the least physical activity possible, then our daily choices about how we commute and how we get around and how we play outside are defined by planning policies, transport policy, sometimes as simple as where we put the lift and the stairs in a building. So those opportunities to become more active in everyday life are so important, as well as our structured exercise time. We need that healthy choice to be the easy choice when we're thinking about our everyday life. So as well as programs like Project Weight Loss, providing opportunities for people to be active in their own community, we also need to look at the broader environment that we're all living and working in, helping us to be active too. Okay, so in summary, just to finish on some notes of what we've covered and what we hope to cover as we go on with this training. So we know that community exercise programs like Project Weight Loss are an important part of current health policy in Ireland. But we first need to understand obesity if we are going to be the people that are going to be supporting people to lose weight and to become more active and sustain weight loss. That everyday diet and activity choices we know are made in that broader obesogenic environment, and it's important to appreciate how that operates. We need to focus on primary prevention. We also need to support people who are overweight and obese with best practice interventions that are going to provide them with sustainability when it comes to weight loss. And one of the best places we can start is by providing that obesity education and training to everyone that's working with people to try and support them. We in turn can then educate them, but also learn from those who are struggling to maintain a healthy weight. So I hope that's been of some use. I realise that was a very fast overview and a lot of information to take in, but I'm happy to answer questions at the next element of this training. And I want to thank you all for listening and look forward to meeting you again on the next training on the Zoom call. Okay, thank you all for listening.